Hi everybody, Jennifer Blevins-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today we're going to talk about establishing patient communication workflows in your office with your staff. Unfortunately, this is something that kind of gets overlooked with the hustle and bustle of setting up the rest of the aspects of the practice, but some of these workflows are really important, not only because it can definitely affect patients and their safety, but it can put you at a high liability, or it just gives you a bad reputation if it's not handled appropriately. So I'm trying to bring up some of these so that maybe you can be a little proactive before you open and put some policies and procedures together specifically for these topics, and then train your staff appropriately so that when this does start occurring in your office and they do experience, they know how to handle it flawlessly or close to flawlessly, and you don't have to worry, and the patients are being taken care of properly. There are many different reasons why patients would be reaching out to your clinic, and it could be anything from a prescription question or concern to calling back per the provider's request to check in and see how they're doing, to talking about their financial situation and a bill, to wanting to make a complaint or a compliment. I mean, who knows? But patient communication is an everyday occurrence and it needs to be handled appropriately. And some topics or questions or issues need to go to one person, and then maybe the others will go to a different one. But it's letting your staff know up front which of those topics go to whom so that things get routed appropriately and the loop of communication back to the patient gets closed efficiently, and that patients feel good about calling your office and getting a response in which they feel comfortable and happy about. This day and age, ma'am, people can put a bad reputation on the internet, and that's where people look a lot of times to see how you're rated. So you just want to do everything right when it comes to reputation, because that stuff spreads like wildfire. But also, patient safety is the number one concern, and that's why I wanted to bring this up. Patients can communicate with the office in various different ways, so you need to make sure that your policies and procedures address each way in which communication might come in. And then, like I talked about, depending on what kind of communication or what the topic is, making sure it's getting routed to the appropriate person the first time and quickly. So the different methods of communication that patients can use, of course, telephone, fax, they could stop in and want to leave a note for somebody, so the front office or someone will take a note. They could send it through snail mail. Yes, that happens. They might somehow get a hold of one of your private in-house emails and send it that way. The patient portal, if you offer that through your EHR, then that could be a main way of communicating. But there's various different ways that they could be communicating with your office, and so just making sure that every single place where they can communicate is being checked regularly and responded to and triaged is very important. Now, there's certain topics that you might want a designated person in your office to handle, and then there might be other things that the department or a group of people can handle. And these are things that should be laid out very detailed and specifically in your policies and procedures and should be trained to your staff upon hire. Like if a patient is calling or communicating or inquiring about something they forgot that was mentioned in their last office visit for a follow-up, or that medication is too expensive, or the medication isn't at the pharmacy when they went to pick it up, something like that. Most likely you're going to have your whole back office be able to tackle that, so it would go to a group of people, correct? But if it's regarding a complaint, you're probably going to want it to go to a specific person. If it's regarding a bill or some kind of patient account information, that's probably going to go to a specific person. So making sure that the people who are going to be responsible for responding know that they need to be responding, and I would definitely set out a time frame of how fast things should be responded to. Even if you don't have an answer right away and the patient's anxious, or you might not be able to get their answer to them until the next business day, you should still be calling the patient back and just say, hey, we got your message. I'm so sorry. We're not going to have the answer for that until tomorrow at the earliest, but we will keep you updated. I just wanted to call and let you know we didn't forget about you, and we do care, and we will be in touch as soon as possible. Patients really appreciate that. Even if you don't have the answer they're looking for when you call them, at least least acknowledging that you see and know and remember that they are waiting holds a huge amount of weight in that regard, and they will trust you more and more. So it's really important, even though you're not fully closing that loop of communication, you're at least communicating with them, acknowledging that you will close it once you have the information you need to provide to them. The front office should be very aware that there are some things that they can answer at that time that the patient is there or calls on their behalf. Like, they don't need permission from someone else or another department. So if somebody's like calling and they go, oh, I was referred to another specialist when I was there, but I can't remember who it was, or I need the phone number, there's no reason why your front desk staff can't go into that chart note, find out who they were referred to, or look at the referrals list in the EHR and provide that information to the patient right there. You want to make sure that when you establish these workflows, they're as efficient as possible, and there doesn't have to be so much back and forth between patients and your office, and also that patients get their answers quickly. Remember, every time that your staff has to try contacting a patient, that's money, because it's time, and time is money. So when you're developing these, make sure they're efficient. And you know what? You might put something in place and realize that it can be more efficient down the road, or a better way to do it, and you change it, and that's totally fine. Definitely make sure, especially if you're opening a new practice and you're just establishing this, to have it down and you work for a few months, get feedback from your staff and find out how things are going, and if they think there's a better way, or they know there's a better way, they discovered a better way. Always encourage feedback from your staff, and maybe even if it's not going to work correctly when they give you the feedback, be appreciative of the feedback and let them know that you do encourage them to continue giving feedback and giving advice, because there are going to be times that you will take them up on that, and there will be other times where you might know a little more, or it might not be a right compliance type thing or fit into something quite right, and you can't do that, but then you can explain why, and they learn from that too. Feedback from the staff and who's actually doing these workflows and who's actually communicating with the patients are the ones you should be listening to. I would also do some training with your staff, especially if you're in a specialty that might have a little bit more of an emotional type patient base, whether it's oncology or some type of rheumatology, people that maybe receive bad news or are in pain a lot, maybe a pain clinic, that you can help teach them how to not take things personally when patients are on the phone and upset and emotional, because it's really hard for a lot of people to not take that personally when you're communicating with those people. And they don't necessarily mean to aim it at those people on the phone in your clinic, but it just comes out that way. So another part of the workflows and communicating with patients is I encourage you to do workshops and be checking in with your staff often about how they feel about, how patients are treating them and how they feel like they're being able to respond to those types of situations. And maybe you can give them some tools and resources on how to handle those better or in a different way, because there are times that people just get stuck, in a really uncomfortable situation, and they handle it the best they can at the time, but maybe afterwards they're like, ooh, I could have done better, or I shouldn't have responded that way. But the only way that they're going to know that or have a change in the future and know how to do it differently is if people can help them a lot of times. So make sure that you're open to them coming to you when they're frustrated or upset about a patient and how they communicated with them, so that maybe you can make sure that you can coach them or ensure them that, it wasn't towards them or whatever they need, because it can be really wearing when you have people constantly upset with you over the phone, even though it's not your fault. And so that's part of the communication as well with patients, is acknowledging and knowing that patients might not always be nice to your staff, but letting your staff know that they need to be nice and respectful back, even though they might not agree with it, or they're uncomfortable, or they're offended. And then maybe you as a provider can approach that with the patient the next time they're in. And a lot of times it's not intended that way, and patients feel really bad after the fact, but it's probably better for the provider who's closer to the patient to deal with that on behalf of your staff member than the staff member to do it themselves. I'm not going to lie, there's been probably twice in my whole 20 years of working in medicine that I have actually had to hang up on patients because they were just being so profane on the phone and cussing, and I stayed calm and I asked them not to talk that way to me and told them they couldn't talk that way to me, and they continued, and so I just hung up on them. But other than that, I have tried to de-escalate situations, and there are times I get off and I'm so frustrated and I have to walk away, but you know, it's one of those things of just trying not to take it personally. But when it's repeatedly in a day, it seems like you get them all at once, it can be really hard. So just be mindful of that with your staff and put that part of your policies and protocols that you guys are open to hearing when someone's frustrated or just need to vent, so that they don't take it out on patients. If you have any suggestions for me on different topics to do in the future on workflows, please put that in the comments below. And if you have any questions for me, I encourage you to leave that in the comments as well. Smash that thumbs up button if today's visit was helpful. And also make sure that you check out my other videos that I've done. And I really appreciate the support. Subscribe to my channel if you feel this is going to be helpful for you. And I hope you take care of yourself. Bye-bye.